All right, welcome back. All right, our hybrid session today is titled Collaboration in Action, Building the Child Wellness Campus. For this session, we will be joined by a panel of presenters coming from Cuyahoga County, Ohio. Our first presenter is David Merriman. David is the director of Cuyahoga County's Department of Health and Human Services. In this role, he leads the county's human services divisions to include children and family services, job and family services, senior and adult services, and Office of Child Support Services, and the community initiatives, which includes Office of Homeless Services, Office of Reentry, Office of Early Childhood Services, and Family and Children First Council. Next, we have Karen Storman. Karen is a licensed social worker in the state of Ohio. She has over 28 years of experience working with families and children in both direct service and administrative roles within Cuyahoga County Health and Human Services. And in her current position as Deputy Administrator with the county's Division of Children and Family Services, Ms. Storman oversees the supportive services, contract resources, and placement areas within the agency. Danya Underwood is the executive director at the Centers H.O.P.E campus and is an experienced executive leader, respected researcher, and author. For over 20 years, she has partnered with community-based organizations and federal, state, and local governments to support vulnerable people, focusing on justice, empowerment, and community well-being. Danya excels in program development and driving strategic initiatives that transform intervention into prevention. Leah Dalton is an SSA manager with the Youth and Transition team from Cuyahoga DD. Leah is a dedicated leader with over 25 years of experience serving individuals with developmental disabilities and their families. Leah has spearheaded innovative housing initiatives such as Experienced Living with college students, TriTech Apartments, Youth Respite, and the Youth ICF. She is passionate about person-centered planning and multi-system collaboration and ensuring youth and their families have the tools and support to achieve their goals and live their best lives. Stephanie Hayward is an SSA supervisor with the Youth and Transition team from Cuyahoga DD. Her 17-year career with the agency includes multi-system collaboration and training, emergency and crisis planning for youth, coordinating respite admissions, and building collaborative systems that strengthen the continuity of care across agencies. Stephanie has played a key role in establishing youth and adult respite homes and a youth ICF, developing operation processes and partnerships that support them. Stephanie is dedicated to creating effective, compassionate solutions that improve outcomes for youth with complex needs and their families. And Erin DiVincenzo is the Director of Prevention and Children's Behavioral Health Programs for the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. In her current role, she supervises the Children's Unit and monitors the performance, quality, and accessibility of prevention and children's behavioral health programs funded by the Adams Board. The programs under her I can't read my own writing. Under her supervision include children's crisis, residential, school-based, infant, early childhood mental health, substance use disorder, and juvenile justice-related services. So let's welcome our panelists.
Hi, everyone. Thanks for having us here today. We're excited to be able to present and share information on the Wellness Campus and the work that we've done in Cuyahoga County. I'm excited that we've got a lot of our community partners here with us today to be able to talk about all of the work that we've been doing over the past few years, explaining where we've been, what we're doing, and what's next. So we will be able to go through, everyone's going to give a little bit of information on the work that they're doing, and then we'll take some questions at the end as part of a conversation. Thanks.
Good afternoon. Thank you very much for being here today and taking some time out to learn about this approach. Just want to start by acknowledging this is not a fully baked strategy. This is something we're still learning on. So if we jump straight into strategies and tactics, those are still being tried. They're still being refined. And we're all open to questions today, tomorrow, whenever. Happy to have offline conversations. As introduced, my name is David Merriman. I'm the Director of Health and Human Services, and I think went over to departments that I'm associated with. And I think one of my principal roles is to work with our aligned systems. And for us, that is the Adams Board, that is the Board of Developmental Disabilities, and in the state of Ohio and others. So I'm very happy to be here. I want to thank the OACB for sponsoring this conversation, and especially thank Leah and Stephanie and Amber for helping us get this off the ground. I think they're partners, they're co-authors, and they've stuck with us. So thank you to the team. So let me begin. Let me get a show of hands. Has anybody worked in this system for more than 5 years? All right. So you were around during COVID, right? Just think about that for a second. Put on that virtual mask and go back to that period where in the middle of COVID stuff was happening that we're like, wow, this is weird and bad. And one of the things that I still reflect on was periods where there were kids and usually there were multi-systems youth and teens that were coming into our building, and our model for treating them just broke down. And I'll speak a little bit about why that was the case. But, we started to find ourselves with young people, mostly teens, in our building. And we were going to our providers, and my director of contract administration and performance is here, Marcos. And we have, 75 to 80 providers. And we were reaching out to them and say, hey, we have this youth. They're in our building. Will you take them? And it was a no, not that one, no. And we'd go through every single one, and every single one would say no. They'd all say no. And we'd say, so, okay, we get it. You have your rate. What would it cost? Tell us what it would cost. And they'd be like, no, there's nothing you can give us to take that kid. So we'd say, all right. What would it cost? And we'll give you $5,000 on top of it. No. $10,000 on top of it. No, there is nothing you can give us to take that kid. And so I think we're going to talk about this from our systems experience. But at the end of the day, these are children that were being rejected, and we're living in an office building on the corner of 40th and Euclid. And, if this is a story about systems, okay, that's why we're here and we're in this conference. The story is really about youth being raised in an office building that were abandoned by every system in America, every provider in America, and were living their lives on a day-to-day basis in an office building in downtown Cleveland. So they may not show up in a lot of these charts, but that's really what the story's about. So as we got into this, we would have these children in our building. And as I said, most of them were multi-systems: Adams, DD, juvenile court, child welfare. And so we started to engage the aligned systems. Trying to get this to advance. Let's see if So as we were starting to work through what to do with these children that were in our building, we started to engage our Family and Children First Council. And in Cuyahoga County, that's a peer of ours. It's one of our teams. And Robin Martin, our director of Family and Children First Council, as an executive committee, and she hosted a conversation where I brought together, is actually Amber's predecessor, Kelly, along with the prior director of the Adams Board, Scott Osicki, and the juvenile court administrator, the director of our Education Service Center, our child welfare director. And I started to explain the problem. And what we started to talk about was, okay, so have we tried all of our providers? Yes. Can I try your providers? Well, there are providers. We've tried them and they're saying no. And so, we were finding no solution. And at a certain point, we just started to recognize we had no answer. When every provider that was under contract with us said no, we had no answer other than to allow them to live in our building. And so we couldn't accept it. Obviously, we couldn't accept that for those youth. More importantly, we couldn't accept that for our community, because that's not a standard that you can really sustain for more than a day. Let's just say that. If it was overnight, that's one thing. If it's a day, that's one thing. But we're talking about youth started living in our building for weeks at a time. And for some, it was getting months at a time. And that is not a home. And that is, maybe they're safe, but even that became questionable. So we reached out to some of our peers. I reached out to Hennepin County, which is Minneapolis, Minnesota. I reached out to Allegheny County. I talked to some colleagues from Mecklenburg County and said, what are you guys experiencing? And they're like, yeah, same thing. We're all going through the same problem. And what I heard from actually it was Hennepin County, a colleague there, is we're approaching this differently. And I think this first slide really speaks to it. Everybody wants to know about the child welfare system. What is the child welfare system going to do for these youth? How are you going to place and serve someone who has been rejected by everyone? And as we thought about it, we were pushed back to say, listen, first you need to recognize you're the child protection system. Child welfare is a community value. Either your community believes in welfare or it doesn't. And what you're experiencing is challenging, whether or not your community actually believes in child welfare. And what is child welfare? So for us, I think it is this central structure here. And there's others. We could fit many others into that. But a lot of it is, it's DCFS, Children's Services, it's Juvenile Court, it's the Adams Board, it's the Board of Developmental Disabilities, it's Family Children First Council. There's others, police departments, schools. There are a lot of other institutions, hospitals that are involved in this. But as a community, what do we want to do? What's a priority? And is it acceptable to allow a 17-year-old to turn 18 in an office building without a plan for their future? And the answer is no, it's not acceptable. So we have to come up with something different. But unfortunately, we are in the middle of COVID. And we had these youth living in our building for extended periods of time. Most kids weren't in our building for more than a day, despite what you read in the news, because the news was absolutely destroying us. They were all over us. The county needs to get the kids out of the building, and that story is still running. I think it's on a hiatus right now, but it's going to come back at some point. Most were not staying in our building for more than 24 hours. Those that were most likely multi-systems youth, high-end youth. Many of them had autism. Many had other disabilities. Some had children. Many had co-occurring conditions. Some were diabetic. We found that to be, when there were that plus diabetes, that got really, really difficult. And the placement crisis that this came to be understood as was not just a local issue. This was really a statewide. This was a national issue. And as we read the newspapers, as we followed this, and we all rushed to read every single Times article or every article about it, not to get sort of the commiseration that we were looking for, but to see which providers the other systems were contracting with so we can immediately get them under contract. We were intelligence gathering. It was a race, and it was an arms race. We were all going to every provider asking how much we could increase them just so they would start considering our kids. But what we didn't understand is we were in the middle of an economy that was working against us. It was a simple matter of supply and demand. And over the prior 2 decades, the supply of residential services available to Cuyahoga County was declining significantly. We talk about 200 lost placements. It's probably closer to 300. And a lot of that begins with a really wonderful effort by the Juvenile Court to close the Hudson Development Center. This was a residential campus in Hudson, Ohio, just outside of Cleveland. It was more of a camp, more of a farm, but that was for lower level offending juveniles. It's 300 beds. They closed it. They sold the property, and they said, this is not good for teens. And they're right. It was not good for teens. And they said, we're just going to use the existing residential capacity that exists in Cuyahoga County instead of incarcerating them. It makes sense. It's a good idea, except over the next couple of years, suddenly we had the Children's Aid Society closed. When I was a child welfare worker, I used it all the time. It was a great facility. There was a merger and then a closure. But we're like, okay, you lose a provider, you gain a provider sometimes. Then we lost Parmadale. Anybody place children with Parmadale? Remember Parmadale? For us, this was it. This is where we send kids. There was a restraint that turned fatal, and they were done. It's horrible, but they were done. Parmadale closed, and then we lost Beachbrook. And we just started to realize if you lose over 200 beds in your community, I think it is closer to 300, that's simply a supply issue. And for a period, the demand was down. But when COVID hit and providers could pick and choose, when a provider could get 3 offers for a single bed, and they could see, is this a level 6 kid, a level 5 kid, a level 4 kid, and they're all going to pay the same rate, what do you think they're choosing? Who's taking the 6 over a 4 if all things are equal? It's understandable. But that just meant all of our level 6 kids were being rejected. And there was nothing we could do to make them change their mind. We actually tried, to be clear. We brought in all of our largest providers, the county executive, the county's chief of staff, our former prosecutor brought them in and browbeat them and said, we need you to start taking our kids. And they said, we will really think about it. And some did open up some respite beds. I'll give them credit. But for the actual residential beds, we put out 2 procurements, and twice, no one bid on giving us a residential center that was going to meet our needs. So at that point, what we did was step back, and what we looked at was, and I'm gonna transition on this point here. What we looked at was, would a provider stand up and do a no reject placement? Could we start to have a provider under contract that would charge us and would pay us? I'm sorry, we would pay them to hold beds and take our beds. And we could get that for younger children, but for these older children, it was getting pretty hard. And if they rejected us twice, if all the provider community rejected us twice, we realized they're probably going to reject us a third time. So instead, what we did is we asked Amber and Kelly, we asked Scott, we asked Timmy Divot from the juvenile court, we asked our Family Children First Council to co-author an RFP with us. We put it together. We released it as a community together. And what we said to the community, we had a large forum before we went out to bid and said, you want to reject DCFS because you feel you can do that now? You've done that. That's clear. Are you ready to reject all of the public systems together? Are you ready to say to all the public child serving systems, you don't want to do this? And because I think there are going to be people that will say, yes, they do. And so we put this out to bid. And on the first round, we got 1 proposal. And we were pretty excited about that. This is my transition point. And so what we did is, so we went with the new provider. And we showed the provider network, if you're going to say no, somebody else will say yes. And this will go in a direction that will actually meet the needs of our children. That they will not accept that they are going to be rejected by everyone else. By the way, that means serving some pretty hard to serve kids. We should all be clear on that. So with that, I'd like to turn it over for a provider, a perspective on the broader system and what was happening with child welfare that led to this.
Thanks, David. Good afternoon, everyone. I'm Karen Storman. I am one of the deputy directors at the Cuyahoga County Division of Children and Family Services. And I won't reiterate a lot of what David said, but I'm up here representing the child welfare system, but I'm also up here representing the children. And they're not my children, although we treat them as our own. They're everyone on this panel's children. They're our community's children. And so that's kind of where this partnership really is integral, because we need every system at the table to serve these children. They're not one size fits all. Just a little bit about the child welfare system in Cuyahoga County. We currently have, this slide is a bit dated, but now we have 2,073 children in care. This is a number that's been declining over the last 2 decades to numbers that, while we don't want any child to have to come into care, we're only making those decisions when there's a critical safety need. It's something that we are really dedicated to ensuring children stay with their families when they can, and it's safe to do so. As David stated earlier, we were talking a little bit about the national shortage of residential and congregate care options for these children with high acuity needs. And so those continue to diminish, and we saw children sleeping in office buildings. And we, in partnership with the Board of Developmental Disabilities, our Adams Board, and our juvenile court, as well as some of our community initiatives, decided to address the problem, and this RFP was issued. And we had a provider respond. One second.
I just use the arrow.
I'm just going to use this. I got you. Sorry about that. So just this slide is just going to talk a little bit about some of the drivers that were related to the placement crisis. And some of these I'm not going to read to you because you know about the situation. And David spoke to most of it. There was a lack of family home settings that would accept our high need children. There was limited residential options. There were workforce shortages in both public and private systems. We saw increased removals that were tied to families' instability coming out of COVID. There were obviously a whole host of issues that families were dealing with. We saw a decrease in amount of available and affordable housing. The reduction in the number of foster homes in the state of Ohio is not unknown to us. We have over 16,000 children in foster care in the state of Ohio, and about 2,000 of those children require a congregate care setting. In Cuyahoga County, about 10% of the children that we have in custody are in a residential or congregate care setting based on their level of care and what they need. While the numbers decrease in terms of our custody, the increase in the demand for these congregate care and specialized settings continue to grow. So what does that mean for our families and kids? So obviously, if we have children spending time in any setting that's not like a family home or even somewhere where they're getting skilled and the treatment care that they need, there's going to be heightened trauma and emotional distress. We were seeing that not only in the children, but obviously it had an impact on our staff and workforce. We have disrupted routines. We had educational issues, children not able to attend school. All of these things were impacting not only the children that were first and foremost, but our system was being impacted as well. There was an obvious strain on the staff morale, and we continued to see staff turnover and other system impacts. So we decided, along with the RFP, that there were a number of concurrent practices that we needed to think about and how we do business. We wanted to recruit and incentivize kin. Kin First is a priority campaign that we have going on right now within our system. We want to make sure that we have emergency and therapeutic foster homes that are available for our families when they come into care. Ohio Rise expansion and knowledge as far as what's available for families to impact and assist in providing access to care. We had obvious system efforts with the panel here today, the collaboration and implementation of the Child Wellness Campus along with the RFP. We have increased oversight and accountability, and we are really doing a lot of the work before children would ever even come into our building. So we're seeking family, we're seeking options, seeking respite. And so before I transition, I'll just show a little bit of data, and I apologize for the size of this. I didn't realize how small it looks, but as far as the Child Wellness Campus that we have implemented to date, and Danya Underwood is here from the Centers H.O.P.E campus. We'll be talking more specifically about the activities and role from her perspective, but you'll see the total admissions by year when we implemented what is called teen suites, or T suites as we call it in Cuyahoga County. We saw about 53 children coming into the setting in 2023, increased accordingly, and year to date in 2025, as of this writing, was probably 72, or it's probably a little higher at this point. Average length of stay, the children coming into T suites, this is, again, it's not a placement. It's an opportunity for them to be in an emergency and therapeutic setting while we continue to search for an appropriate longer-term placement for them. We did see a higher number of days in this setting early on in the project. However, we are seeing just about under 30 days for the average length of stay currently. And children are transitioning either to foster care or to a congregate care setting that would meet their needs. There's many, the children coming into this treatment setting have co-occurring disorders. Many of them have multiple system involvement, with juvenile court and juvenile justice involvement being the highest. But obviously, as you can see, we have children with needs ranging from behavioral health, developmental disabilities, and child welfare system involvement. I think that I am going to transition now to Erin from the Adams Board.
Erin. Hi, good afternoon, everyone. I'm Erin DiVincenzo. I'm the Director of Prevention and Children's Behavioral Health Programs for the Adams Board of Cuyahoga County. So the Adams Board is an acronym. It stands for Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. And we are the board that's responsible for planning, funding, and monitoring the public mental health and addiction treatment and recovery services for the residents of Cuyahoga County. So my division is over the planning and more of the monitoring. We're one of the divisions that does that for the children's behavioral health programs. So for context, in Cuyahoga County, our public behavioral health system is comprised of, that with the Adams Board supports, is comprised of over 70 behavioral health provider agencies and over 200 programs. And in 2024, those programs served 26,851 youth. And we've received over 114,749 hotline and helpline referral calls. Even though we serve 230 schools of 24 districts, that's not all of them. And so we do have a lot of services and supports, but despite that, we did need to grow and expand our behavioral health crisis services system, especially that served children over the course of the pandemic. We now have multiple 24/7 hotlines with 988 as our local frontline provider. And then we also have 2 mobile crisis teams that are dedicated to children. That's our MRSS team, and as well as our frontline children's response team. We have during the pandemic, we expanded our residential and crisis stabilization beds from 2 providers with 5 beds to 3 providers with over about 20 beds. Those kind of vary depending on utilization. But you see, despite all these services, we still were not able to meet all the needs of the kids that were in crisis in Cuyahoga County. So despite expanding our local crisis beds, expanding our crisis response services that could go right to the community, support them in the home setting, the safety and well-being of our children and adolescents were still a major concern for our community. So this slide is really just a compilation of observations and some of the complex dynamics that we're seeing in our county. There's no wrong door in Cuyahoga County, but we kind of have too many doors where people don't know who to call when or why. And with the complex needs of our kids, we're seeing really high acuity and complexity of their needs. And IHBT and other in-home options were either declined or difficult to access. We had multiple staffing concerns as well. And it almost felt like it was a hot potato, like a quick crisis support, then close. And as before the board, I came to the board as the children's behavioral health specialist in 2019. Prior to that, I worked primarily as a counselor for children and adolescents, specializing in complex developmental trauma. And so one of my main concerns was the use of residential treatment to overly stabilize concerns. So as we developed this complex, as we're looking at this complex problem, developing a collaborative solution really was important to balance the needs for placements with the need to protect children, as well as get ahead of the needs and return the trajectory for as many kids as we possibly could and maintain and support them in the community setting. So that's the reason why the Adams Board support this program and why I continue to champion it. All right.
Thank you, Erin. I am Stephanie Hayward. I'm a supervisor with the Youth and Transition team at the Cuyahoga County Board of Developmental Disabilities. I think that when we're talking about the child placement crisis and kids in general, the work is never done. So when we were asked to,
When we were asked to partner with this and we were talking about the campus or child wellness in general, it was a no-brainer. We jumped at the opportunity to come to the table and to work with our partners. We have had kids who have been dropped off at the building. I know David touched on this. They're dropped off by families, by police, by the hospital, by providers who've been, swearing to serve them and to support them. So those are some of our kids and how they have gotten there. In addition, we also have kids who may or may not be ours who get dropped off at the building. So we will have someone from DCFS reaches out to our liaison and will say, hey, we have this kid. Do you know if they're linked to you? And if not, what do we do? How do we get linked to you? And what does that look like? So we have a liaison at our agency as well as liaisons at other agencies, and we will send them to our eligibility department. We can look into it, see if they're there. And we're also there to just provide support. So if they're like, hey, we have this kid and they came in with this need, we can talk to them and work through, are there some support needs or just general conversation that we can have about that child. When this campus started, there was a lot of questions, and specifically, we have kids who have to meet our eligibility criteria to receive our services. So when they're going in to the campus, a lot of the questions that we had were very specific to our children. So where do kids who have a developmental disability fit into the wellness campus? And how will they be integrated into settings with typical individuals? How are staff going to be trained on how to best support the kids who have a developmental disability? And then how are we going to be brought to the table for planning? When asked to support this project, we were there, we're at the table. We have provided funding. We provided funding for the capital fund for the development of T-suites, as well as funding for renovations to the Hope campus. We also provide some funding for our kids who do utilize the beds who are there. So we do some cost sharing for that. We have partnered on the planning committees. This is a huge project and it has been years in the making, meetings upon meetings to get people together, bring people to the table to brainstorm, throw out all of the ideas, see what sticks, see what doesn't, see what we need to rule out. I think that we all talk all the time about, hey, who needs another meeting? But those meetings are where the work starts and it gives us that direction to move forward. We share our knowledge. So knowledge specifically to process or procedures, or for the kids specifically, we have an entire department within our agency that we can reach out to. So if a kid who has a disability ends up at the building and maybe they have some sensory needs, we are able to reach out to our team and ask for them to collaborate, give us that information, share our knowledge about those kids. We are able to make recommendations and do assessments for them. And all of that is to assure that those kids are being supported the best way that they possibly can. And also the staff. So the people who are working with them, we want them to feel confident in their ability to support those kids. Again, being a partner. This is work that is not going to end, and we continue to be at the table and we continue to talk and brainstorm, work with all of these agencies. I think we're only a part of who's here at the table. The entire system of care within, the county comes to the table and talks. We've seen hospitals and school districts in Ohio rise, and I'm forgetting like a million people, but anyone who we can think of, we reach out to. Hey, we need you at the table. Hey, we need to talk to you about this. And so that partnering, it just is across the county throughout all of the agencies. This is where I need my notes. We've been asked, in general, what is the vision that we see for the Child Wellness Campus and for our kids who go to the center? And really, at the end of the day, what we want is that we want our kids, and that's every kid who's in the county, we want all of them to have a place where they can be safe, where they can feel secure, where they have all of the systems and supports that they need wrapped around them. And at the end of the day, they know that there's a tomorrow for them and there's a little bit of hope for them. With that, I'm going to hand it off to Danya, who's going to talk about the Hope Campus.
Good afternoon, everyone. So you've heard from my colleagues, peers, partners, right? I think that, they spoke very well, really about our partnership, right? I just want to emphasize that we could not do this work alone, right? As Karen mentioned, these are our children. And there are so many other stakeholders, like juvenile justice that's at the table, FCSC that's at the table. We have all of our crisis stabilization folks at the table, all three hospital systems. And I walked into this work, so I can't take credit for all of the partnership that was led when I arrived. And so I have an extensive, kind of background working with children, right? It's my passion, just the same as my peers here on the panel today. And one of the things that I think that I was just like enamored with when I came into Cuyahoga County was that there was a commitment of like over 30 partners to meet on a monthly basis to stand up the Hope Campus, right? And really not just to stand up the Hope Campus, but to ensure that children in our county got what they deserved. And one of those things was deserving to have a bed that was in a home-like trauma-informed facility, right? And that was just the recognition of where they were arriving. And so you heard David speak to that. So I just wanted to, as my intro, and really my real thanks and honor to the partners that I work really closely with. So the Hope Campus, right? We're on the west side of Cleveland. We were just merged. We just merged with a large behavioral health organization, the Centers, and some people may see it, may know it as the Centers of Children and Family. And it is a conglomerate of mergers, right? And so you may have heard of the Free Clinic or Circle Health. And so we have 4 pillars of work, right? And so we have integrated health and wellness, we have workforce, we have early learning, and then our 4th pillar is youth and residential services, right? And so that is what we are doing. So we are the former Cleveland Christian Home on the corner. If you're familiar with Cleveland, it's on the corner of like 114th and Bosworth, right? It's an anchor in the West Side, right? And so over a century old, originally providing services for exactly what we're talking about, right? Children that had no other place to go, right? And so it is a historical building. You heard Stephanie speak about kind of the renovation. So it needs an entire overhaul, right? And to ensure that children are safe and that staff are safe in order to do the work with some very complex children with very complex needs, right? And so really thankful to the partnership and the funding assistance, right, in our capital efforts. And so we are really a program in motion, figuratively and literally, right? And so my 2nd floor right now is currently under construction, right? We're building a new school so that children have a proper place to be educated while they are with us. So that's a little bit about, kind of our campus. I'm going to show you some pictures of what we have underway, but that's a little bit about who we are and our history. So again, corner of Lorraine and Bosworth, 3 acres. So when you think about 3 acres, for a home that's pretty large. When you think about a campus, there's other campuses, that are 4 times, maybe 5 times the size, right? But I think in Cuyahoga County, we have this we can and we will spirit, right? So we're going to make it happen. We're going to do what needs to be done to ensure that children have a safe place to reside when in crisis, a placement crisis, right? And so again, can't emphasize enough that this was built on partnership. And so our facility has 6 units, so 6 wings that we recently just completed that renovation. So we have 6 units that can serve between 6 and about 8 children on each unit, depending on, kind of need and complexity and licensing. So we do currently have those completely renovated. And so when I said the whole campus is being renovated, I mean the whole campus. So it is a historical building that we have to maintain and want to maintain within our community. So not just the school, but our cafeteria getting really a redesign, building the new school on site. and some other components that I will continue to share throughout this. So overall, our vision is really to show what is possible. It's really to show what's possible when we care, right, and coordinate and compassionate care for youth. And so our goals, there's 4 that I want to mention here. So provide a continuity of quality services for youth in residential care and in community settings. Provide youth with access to education, recreation, medical, mental health, and stabilization services through instill skills and resilience. Instill skills of resilience, but our kids are very resilient. Know that. And then, competency necessary for independent living and self-sufficiency. So that's really our goal, right? We are there. When you think about a conductor on a train, right? We're a conductor on the train and they're going to get passed off to the next train. But we want to make sure that we are instilling what we can when we have the youth with us. And so these are some of those goals that we hope to achieve while our youth are with us. So let me just talk about some of our core components that I think are very fascinating. And this is what happens when you reimagine child welfare and child protection, right? And so walking into an enormous, innovative project was very fascinating. So I'm going to start in a little bit a different order. So our services right now that we are providing are educational services for children. So provided by Cleveland Metropolitan School District, but not all kids go to school on our campus. There are some that arrive in residential. And when you think about residential, right, kids walk in and they're stripped of a lot. They're stripped of family, they're stripped of community, they're stripped of education, their friends, and the list goes on and on and on. So one of the things through this project is, do all children have to go to school on site? No, they don't. So if they're established with a school, we work with DCFS to figure out transportation to keep them at their home school, because that's where they're going to transition to. You heard Karen say, this is not long-term care, right? This is emergency placement. So allowing a little bit more time for DCFS to do what they do, which is find the next best placement for a kid, right? Rather than 4 different maybe transitions to getting them to the next best place. Let them stay with us for some diagnostic and assessment, so wellness services, as well as, helping navigate what their next best placement is. We also have a gym that gets utilized a lot, as you can know. So kids love the gym. I think that's the one activity. They're just like, can we just go to the gym? And it's just to go to the gym. But we can transform our gym into a skating rink for kids, basketball, we have volleyball in there. And that's also going to get a little bit of a refresh as well. Our cafeteria, where we have centralized kitchen through the center. So through our large organization, which helps with our overall logistics, right? It's a kitchen that I don't have to be concerned about. So I can focus on children. And so really the support of the centers, leveraging that support. And then we have a staffing model that is very unique, I would say. And so we do have a high ratio for children just because of their high complex needs. We do have between a 1-to-4 to a 1-to-2 ratio, I would say, depending on kind of the needs of the children, but primarily a 1-to-2 ratio for our youth. One of the other differentiators that I wanted to share was around our nursing. So you heard, I don't know which panelist mentioned about the medical complexities of youth, right? So when I recently looked at our stats, medical complexities that did rise to the top were both diabetes and asthma. So when you think about the disproportionately children in care are Black and brown children, and that is on the rise in many communities. And we're seeing it with us as well. And so we have 24/7 nursing, not on call, but that way, excuse me, that we are able to accept children with medical complexities. Like just recently, a child arriving with diabetes, levels at, I think, like 400 or so, right? There are other residentials that would be an exclusionary criteria. But for us, it's let's figure out how we can support and provide those wellness services. So our 24/7 nursing is very critical to our operations. And then lastly, not stood up yet, but one of the most innovative things that when I walked in the door, I was like, this is fascinating, which is a 24/7 welcome center, which allows for this to really leveraging this public-private partnership that we have with Cuyahoga Division of Children and Family Services. But it allows us to reimagine the front door child welfare. right? And so allowing for children and however they arrive, alone with a parent who's saying, I can't do this, or alone because they found their way, or they may have had a placement disruption. But no matter what, I think it was Stephanie's slide about, no, it was Aaron's slide about no wrong door, I believe. Yeah, so no wrong door. That's all we want, right? Is walk it in. Even if it isn't your place, it will be your place because we're going to help you navigate to the door you need to walk through. And so this is just an opportunity for us to reimagine the front door, but through this public-private partnership. And one of the things that I really find fascinating about it is when you think about the child welfare system or the child protective system, people aren't raising their hands asking child welfare or child protective services for help, right? In many communities, I'm originally from Chicago, they're not running to the door to saying, I need help, because there's a misunderstanding of the assistance that the child protection and child welfare system provides, right? So when you think about this reimagining front door, that's not a county building, but on a residential child welfare campus, it may, I believe that it's going to offer individuals in crisis to understand that there is assistance and how we can help navigate. And it's not for us to, we don't want more kids in care. As you just saw the slide from Karen, we're on a trend of downward, right? Of the children that we are accepting in care, because we want to divert them from care, keep families together, and provide services in their home, in their setting, if safe and if appropriate. So those are the components that I wanted to share, and some of the foundational things that I've already stated previously. So can I just do a couple more minutes? Thank you. So this is what the campus is going to look like. I'm a walker and a mover, so let me just stay still. So our campus doesn't look like this right now, but it will, right? And so, some pretty foliage, around the campus. Right now, our campus is not a secure campus, meaning our grounds are not secure, right? And so our kids are very familiar with their community, right? And so when children wander or get off campus, not saying that they don't, because they do. And so, we're looking at, building fencing around. And so ensuring that our campus is secure, not to keep the children in, but also to keep the community out, right? But also allowing for children to feel safe in their environment is very critical. So can you all see my little arrow right here? Right? So that right now is an empty building now. Children were going to school there, but that is where we are reimagining our 24/7 welcome center, where we will welcome children and families that are in a placement crisis. So this is the front. It does not look like this. So we are at all. So we are going to, redo our parking lot. Some people say, if you've seen it, like, we're kind of falling into Lorraine Avenue. And so do a little, cosmetic work there, but, making sure that the grounds are free of debris and just better access around our campus. So this does not exist. So the back of our building is closed off. But what we want to do is to ensure that there are that there is another entrance for the Welcome Center. So this kind of awning allows for police or fire to arrive without issue. Because right now, they do have a badge to get into our, kind of gate. And so making it ease for children to also arrive. And these are just images of what we are trying to create within the Welcome Center, which are, again, child-friendly, spaces for children that have movement, but ensuring that it is child-friendly and trauma-informed. So just some other images here that I just wanted to share. And I think the other thing that I will end here is that you've heard all of us speak. I think if we could have brought a youth here, we would have. Right. But one of the things that we are doing within the campus is we recognize the importance of youth voice. So we are dedicated to authentic youth engagement, are really walking alongside us. Our partner is leading us in our community. It's called A Place for Me, really leading the conversation with us. And so we are very excited to engage young people in our entire process, from policies and to procedures to the colors on the wall, to staffing decisions to even kind of our renovations. So we're really excited to be launching that initiative. So just wanted to share some of the another cool thing that we're doing in the county. So with that, I'm going to pass it over to David.
We're going to open it up to questions here. I do want to close on a couple key points. I think when you've seen the illustrations of what the system or what the campus will look like in the near future, we've raised around $14 million to do the renovations. That is going on right now. That has included capital dollars from the state of Ohio. Really grateful for them. We've also raised money from private foundations as well as corporations. And I just would tell you, if this project doesn't get going, we lose another 70 beds. I'm confident that the Cleveland Christian Home was going to close if it hadn't emerged. That would have been another 70 beds coming out of our community. Other thing I do want to also share, this is a no eject reject facility, which means when we call the centers or when we call the Hope campus, we'll say we have a kid, we are looking for placement. You should know that they're coming to you. It's not a no. It's not a we'll think about it. This is our choice. And they work with us on it. It is also, they don't give up on a kid. When it gets tough, and I need to tell you this, these are the toughest kids we have. These are the kids that have been rejected by everyone else. They can't give us a 2-week notice, or some of our providers do a 2-hour notice, and show up at our back door with the kid. As far as I know, maybe other than Trumbull County, which has their own facility, this is the only no eject reject placement of a county of our size in Ohio. And it's a work in progress. It is really hard. Early on, there were times they were like, we can't handle this kid. And we said, well, that's your job. And let's work it out together. And we have. There have been times that we've said, all right, you can't handle them. We'll keep the kid with us another day. Well, we move one kid out and put this kid in. And listen, we don't want to shuffle. We want permanency. We want as few moves as everyone else. But if there's a youth that's in our building and they're a risk to themselves, or they're just struggling because they don't have any services, that becomes the priority. We stabilize at the Hope campus, we'll move a kid out and we'll move another kid back in. And this is really expensive. This is very, very expensive. They hold beds whether we use them or not. There's a huge cost to that. But the flip side of it is those children would have all been in our building that entire time. And for many of them, some of those slides had kids staying up to 200 days. We're talking, more than half a year as we were searching for other placements. I started on this point. I'll end at this point. We can open for questions, but this is a work in progress. We have not solved the problem. We are not holding the perfect solution, but what it is a partnership where we're figuring out what we should do better. And I think that's the spirit of this approach. So I think on that, I'm just going to hand the mic off to Leah, and we're going to open it up for questions.
Thanks, everyone. I guess I'll start with the first question to all of you and ask, what advice would you give as these other counties are now starting to consider wellness campuses for themselves? What things would you think of? What things come to mind that would be some advice, some things not to forget about, some things to think about? Anyone? I saw you looking. That's why I was going to give it to you.
I think we're demonstrating it now, which is partnership. I think that's the one thing that I would probably press upon you all to think through, and that it is not an overnight project. And so we accepted our first kid January of 2023. And so Karen provided those stats. So we're 3 years in from concept, but not to fully ideation, right? And so understanding that it takes, it's going to take vision, it's going to take vigor, it's going to take commitment, and it's definitely going to take partnership. And the other thing that I would say is don't give up on the way if you are considering. The end is near of providing a valuable service within your county to ensure that no children are sleeping in inappropriate placements. I will say, like I said, I'm from Chicago. I've worked in Baltimore, DC. This is not a Cuyahoga County issue. This is not an Ohio issue. This is a national issue that children are misplaced, meaning that they are sleeping in office buildings on cots, blow up mattresses, or pallets that they're making out of blankets. And again, this is not anything that DCFS wants to do, desires to do, but they know it's that what they have to do in order to keep children safe. And creating this this campus, I think, was very innovative. But that's one thing that I would tell people to think through.
Thank you, Danya. There are questions from the group?
Well, you probably want to hold on to that. I'll grab
Okay.
the other one. That way he's one answer. I'll grab one of these.
Do you want to?
And then I can
I just wanted to ask about the training for your staff. Is there certain training that you guys have for them?
Okay. So there's several, right? I think, and again, we're going through iterations of this. But one, we're licensed by ODBH, formerly OMAS, as well as DCY. So there are tons of requirements that are, there are tons of trainings that are required within kind of the first, through their onboarding. And so all of our staff are trained in TCI. So that's therapeutic crisis intervention. You're excited? Great. Question done. No, answer done. No. So TCI is what our staff are trained in. But let me just say this, that onboarding is not one point in time, right? We went from, 5 days, and we're now at 4 weeks. But we got to 4 weeks through what I will say, a learning trip, right? Through a partner that, we sometimes have to place kids out of state, right? And so we were at an organization called Youth Villages. Some of you all may be familiar with it, but they share with me that they did a 4-week onboarding. And yes, we know that that is intense. We know that it can be costly, but we know that it's necessary when you think about the complex trauma of youth. And so now we also, it is a strategy of our parent organization, the Centers Learning and Development. So what we did at the Hope campus is we hired a learning and development specialist for our specific site that then is working underneath the Center's Learning and Development Manager. And I think that all that is going to do is grow, because again, onboarding nor is training one point in time. And so people have skills, but you think about the knowledge acquisition, how are they applying it? You all are here, kind of on a learning and development, kind of a few days, right? And so those are types of things that I think are just important. So
I think something I'll add to that is that the committees that we talked about, you heard Stephanie talk about the number of committees that we're on trying to do this planning because the planning's not done. In those committees, we're having those same conversations about who needs to be at the Welcome Center when. What does it look like when we're together? Not just Danya and her team at the Welcome Center, but all of us as a community. When do we need to be there? What do those kids need from us? What is that going to look like? I think it's just that other big picture. So we're still talking through all those pieces. We haven't made every decision yet, but I think it's important that we're all there. We're all committed to being there. We're committed to saying, who do you need? What do you need? What do these kids need? And how can we do it together?
Yeah, just one other point that I'd want to make. So as children and teens were in our building awaiting placement, they were also training each other. We should acknowledge this. I think the knowledge share, the culture, and the strategies of how to live in an office building and get your needs met became a curriculum. And, I think our staff is amazing. As I said, I'm a former child welfare worker. I know what it's like to work overnight. I know what it's like to go into a home in the middle of the night. And yet, if you have a group of teens and they're all coming together and they all get to know each other, you better bet that they're training each other on how to maximize their environment and their opportunities. So I do think this changes that process by if there is someone in our building, they're there for a very short amount of time, and then they're in an environment that's designed for them as opposed to designed to have an operation for a child protection agency.
What other questions? Yes. Oh, thank you.
So just wondering, is the Welcome Center just going to be for the kids and teens that are staying at the place, or can there be other kids that are possibly in foster care under DCFS that can join in? Because I have a few adult parents that their kids were taken by DCFS. They're still in the court system now, and they luckily are with either family or foster parents, but it's just kind of, I feel like they need somebody else to talk to because they've been separated from siblings, the whole foster care process.
Yeah, so I'll start by saying this, as Danya referenced, the Welcome Center is scheduled to open around September of next year. So they're going through renovation. We're still working through the design and what to include in that space. What's also going to happen concurrently is we're going to close our child welfare building. We're actually going to sell it. It's going to be sold out, and there's going to be a merging of child welfare and JFS into one building. And at that point, that is going to be a very big, very bureaucratic office building. So our goal is to not have children ever spending the night in our building. They're going to have to go somewhere. I need to say, DCFS has done an amazing job with our juvenile rule 6s. Does folks know what a juvenile rule 6 is? So if a police officer encounters a teen, they take custody of them. The police then has custody of that child until they take them to the child welfare agency. And a lot of what was happening that caused the placement crisis is that police were dropping kids off at DCFS, getting them through the door and getting out there as quick as possible. And those became DCFS's problems. And DCFS has created this new strategy that says, before you pick up a kid, give us a call. If you're out at home and the kid is there, call us. We'll come out to you. We'll find the aunt, the uncle, the grandparent, so the kid never comes to our building. We've driven down the number of those kids, so we don't have as many kids being dropped off, but we still have kids being dropped off at 3 o'clock in the morning on a Saturday, 2 o'clock in the afternoon on a Sunday. And that's not going to work when it's a large office building. So the vision for the Welcome Center is this is a place where a child can come if they're being dropped off by a police officer, dropped off by a family member that has conflict. I think the goal is that no kid ever spends the night there, but it's a space that immediately you can get a kid back out, get family support. But if they need to, they can put their head on a cot in a room and they can be safe in that moment.
And I think also just to add to that, to kind of your like, should a kid find themselves in Cuyahoga County when our Welcome Center is up and running, right, and in a placement crisis and nowhere to go, I'm sure that that's a place that a child can come there. We can, again, that no wrong door, and help them navigate which county, who should be involved. But we don't want a child or family to need to figure that out on their own. So we hope to be this place where it'll be well known in the community that if you are in a placement crisis or a young person, you just arrive, we'll help you navigate it.
Great. Any other questions? Okay, let's give our panelists a hand.